Good morning and welcome to COVID-19 Talk with local health authorities. We have with us Dr. David Pearce representing the city of Houston. We are expecting Scott Johnson from Harris County Public Health, and he'll come in during the show sometime. But otherwise, we have David Pearce, who's been with us a long time. Very special thanks to past President Kathy Fininger of Rotary Club of Houston, who has continued to provide us questions, and our producer, Morgan Ash. All right, David, it's just you and I today, so let's go.
Okay.
At least for a while. Let's see. Have previously tested positive and now need a negative test for a trip that requires one within 24 hours of travel. Have been symptom-free. Realistically, what is the minimum time you need for a positive move to negative? Is there alternative documentation if your test is still positive and you're trapped in transit?
Yeah, this is kind of a dilemma because most places are requiring a PCR test, and we found that some people will continue to test positive for quite a long time after their infection. And what's happening is the PCR test is picking up what's being called viral debris. So it's the test itself looks for fragments of the actual virus. And when you're actively infected, this is it. It accumulates in your nose. That's how you spread it to someone. But unfortunately, it appears to be able to have fragments like linger in your nose for quite some time that the PCR test is sensitive enough to pick up. And in terms of alternatives, I'm not aware of any that the airlines will accept. So. Some airlines, depending on what country you're in as well, they will accept antigen tests, which are also looking for it, but the antigen tests are a little bit less sensitive than the PCR test. Depends on where you are and what airline you're dealing with.
Okay, we're going to stay on testing for a while. PCR tested negative, though some in my immediate family are positive. My symptoms sound like Omicron. How often should I retest, or should I just trust that it is a non-COVID illness?
I absolutely would not trust that it's a non-COVID illness, especially if you got symptoms. If you're getting PCR tested, those are highly sensitive, so it would be unlikely that you're going to get a false negative. PCR tests also have a smaller rate of false positives. Now, the at-home tests have about a 20% false negative rate, just because there isn't enough viral material in the nose to test yet. So I would probably recommend, it kind of depends on what your situation is and how frequently you want to retest. If you're going to be having, dinner with grandma tonight, you'd better test this morning. If you're otherwise staying home and isolating, you could probably go every other day, because going and getting tested, depending on where you do it, might be expensive, or you can go to one of our sites, which are free. And then again, you also want to know, how quickly you're going to get your turnaround. So it kind of really goes to your situation. But if you're having symptoms and everyone in your family is positive, I would just make the assumption I'm positive and don't know why you're testing negative, really.
How likely is it that one person in a household will not become ill along with everybody else? It happens.
Yeah, it does. And certainly if you're vaccinated and you're boosted and perhaps you were previously infected, you may have really, really high levels of antibodies and T cells to protect you. So in that situation, I don't know that I'd be terribly shocked to hear that. But for most folks, it's going to be, certainly if you're unvaccinated, that would be highly unlikely to happen.
Will saline rinse lower the viral load in the nose and alter test results?
I don't know of any real scientific data that has looked at that. I would suspect that it would. And I do not take what I just said and recommend that that's a way to get around testing, because that would be a rotten thing to do. Remember, if you are in fact infected and you find a way to cheat on the test, you now put a lot of people at risk that you're going to spread it to them. If you were to do that and it washed viral load out here, that won't make you not get sick, because the virus that's tested that we find in the secretions in your nose is coming from the cells, your own body cells that's producing it. So, I don't know that anybody's done that. It would make sense that could happen, but that would be a really rotten thing to do. And I really would be ashamed of somebody if they tried doing that to get around a test, to cheat on a test.
Don't cheat.
No.
Any idea where to purchase an inexpensive home test? Walking into my office, I just got a call about that.
Yeah, they're in high demand right now, and they're hard to find. So I know that a lot of places, your neighborhood pharmacy and other stores are getting them, and they're pretty frequently going off the shelves almost as quickly as they come in. I've heard of folks searching the web and finding them, and some of the pharmacies are kind of keeping up to date as to which of their stores has them, but they can be a challenge. I don't, whatever answer I give you now, 12 hours from now would probably be the wrong answer.
Yes, and also remember that there are a host of free testing sites throughout the city, and so take advantage of that too.
And if I could just add one thing, so the free testing sites are the PCR tests, and right now, and Stephen, you correct me, but the turnaround time of getting your answers is relatively brief. Now, at the peak back in the months ago, when we had huge numbers of people going and the testing wasn't as robust as it is today, it may have taken 2, 3, 4 days to get an answer. But I don't think that's the case today. I think the answers are coming back pretty quickly.
Debate is brewing about how long to isolate after a positive test, especially since the workforce in many industries is hurting. Can it be cut if you test negative earlier than the current requirement?
Yeah, that's a really good question. That is not the current recommendation from the CDC. I will say that I think that a couple of things about Omicron are at least being discussed. And one is that it appears that from when you're exposed until you become symptomatic, for Delta, it averaged 5 days. That's the average. So some people were more, some people were longer. Some people were less, some people were longer. With Omicron, there is evidence to suggest that window may only be 3 days. There's also evidence to suggest that the duration of the illness is shorter. So with Delta, the isolation period was 10 days. So to this question, nobody has come out definitively to say that, but I wouldn't be surprised if within a couple of weeks we hear the CDC saying that your isolation with Omicron is shorter than 10 days, but that's not the recommendation currently.
Speaking of Omicron, Houston Methodist Dr. Wesley Long said 82% of their symptomatic cases are Omicron. He said, I think you need to consider yourself fully vaccinated only after you've had that third shot. Does this third shot series sounds like a booster, or a fourth shot is in our near future?
Yeah, so that's a really good question. And first of all, I think people need to understand the difference between a booster and the third shot. So the third shot was for people who had chronic immune problems. We're talking organ transplant folks, the elderly, people who are chemotherapy, people with certain immune diseases, where the evidence suggested that the first 2 shots just didn't quite get their immune system up, because their immune systems are impaired, right? There's the chemotherapy, the organ transplant, the anti-rejection medicines impair the immune system, and so they didn't respond as well to the first 2 shots. So that's why they got a third shot. So in that case, the third shot really should equate in your mind to everybody else's 2 shots. So now the issue of the booster comes out, and so they haven't really talked about. I haven't heard a lot of talk about boostering for those who got the third shot. So I wouldn't be the least bit surprised if we hear that talk coming out in the near future, but that's not what I've heard yet. The other thing that's on the horizon is going to be there are the pharmaceutical companies are working on 2 different versions of the next vaccine, and one would be one more specifically aimed at Omicron, and there's also work being done on a vaccine that may be more broad spectrum and cover more potential variants of coronavirus. Now that's not done yet. That's still in the lab and they're still working on it. We'll have to wait and see, but that might be very helpful.
Houston Methodist Sequencing Lab tells a great story. Does any other hospital look at their samples to that degree?
So first of all, let us all give a great shout out, thank you to Houston Methodist for all the work that they're doing. They are sequencing every positive test result they get. They've been doing this through the duration. So this is for any patient who gets admitted, and every patient who gets admitted to the hospital gets tested. If they test positive, it gets sequenced. Also for anybody who's having an outpatient therapy, so you're getting your knee scoped or you're having a colonoscopy or whatever, before you have that done, people get tested. And all the positive tests are being sequenced. So that is a pretty decent sample of the community. I mean, yes, there's a bias there because the folks who are having procedures done tend to be older than not as many 20-year-olds are having colonoscopies as there are 60-year-olds. So there's a little bit of a skew there. But again, the folks who are going for their outpatient procedures are generally healthy. They're asymptomatic. If they had symptoms, they wouldn't be scheduling the outpatient procedure. So this has been really helpful for the Houston community, the work that Houston Methodist has been doing. Other hospitals do sequence some of their samples. There's generally specific reasons why they sequence. They just don't have the depth in the laboratory to be able to do it like Houston Methodist has. But so this is why Methodist has been so helpful. But other hospitals do sequence samples, but they tend to be more selective. They just don't have the laboratory resources to do it.
We'll stay on sequencing. If our tests are not checked for variants, how are health departments so sure the increase is due to a particular variant?
Yeah, so I can't speak for other communities, but like I just said, our friends at Houston Methodist have made it so that here in Houston, we've got a good sample. Now, in addition, our own local public health lab, and for our lab, Stephen, how many counties does it cover? I forget, is it 17 or 25?
17.
17. So our own public health lab at the City of Houston's lab covers a 17 county territory. We do sequencing as well. So I think in most other communities, that's how they're doing is with their it's called an LRN lab. And but we got the extra added advantage of Houston because they're doing Houston Methodist because they're doing so many more.
Yeah, and also I think you might want to speak to the sequencing that is done relative to our wastewater.
Oh, that's right. And we are, Houston was the first community to basically invent this wastewater testing for coronavirus. And we, through our partners at Rice University and Baylor and in our own laboratory, we are sequencing. And it's interesting because the Rice University lab and the City of Houston lab, they use slightly different techniques in the sequencing, and that's done on purpose. So we can, we should be getting the same results. And the people who are doing it I got to tell you, they're very meticulous and they're very thorough. And so this is another way that we can see when new variants are coming in. The other thing we found is that, and we found it with the wastewater, was that what we find in the wastewater, well, with Delta, it was predicting about 2 to 3 weeks what we were seeing in positivity rate, and then that would predict about 2 to 3 weeks what we were going to see in terms of hospitalization. With Omicron, it's been about a 1 week. So we saw a change in the wastewater. The next week, we saw a change in positivity rate, and then the hospital started noticing that their admissions were going up. So much accelerated with Omicron, but our earliest warning is the wastewater. You're right.
The first death for Omicron was an unvaccinated person in Harris County with an underlying condition. What is causing most patients to end up in the hospital?
Yeah, so good question. And so what I'm understanding from my colleagues who are working in the emergency department and are admitting these patients, again, Omicron, for the most part, the symptoms tend to be mild, but there are patients who are being admitted. And again, Omicron, just like Delta, tends to be able to impact basically any organ system. So there are people who are being admitted with heart problems. There are people who are being admitted with gastrointestinal problems. There are people who are being admitted for having neurologic problems. And it's important to understand that we're not labeling everything as COVID, right? So if somebody comes in with a heart attack and they're COVID positive, that may be true, and unrelated. So they're being very careful about trying to recognize who is having their illness causing them to be hospitalized that is because of the virus. And sometimes when they get admitted, it's hard to tell. The final common pathway, if you will, people who are becoming so sick that they wind up in the ICU, that does all tend to be predominantly pulmonary respiratory issues with the pneumonias, and they're requiring ventilation. So that's the common pathway. But in the beginning, they're being admitted for all different kinds of organ system problems. And sometimes it isn't until partway through the hospitalization that you realize that actually is the virus that's causing all the problems.
Really quick, Director Williams, I do believe our Harris County Representative Scott is here by phone.
Welcome, Scott. Is Omicron lasting a shorter time? Any chance the mutations have lost their punch with less symptoms? You spoke earlier to that.
Yeah, so it appears a couple of things with Omicron. I think that this is important for the viewers. One is we talk a lot about the many mutations in the spike protein, dozens and dozens of mutations in the spike protein. But there's another part of the Omicron virus where there's a whole segment that is new. And so that is different. That sounds like what we call reassortment of genes from another virus. So there is thought that one of the reasons that the symptoms seem to be mild is that it being a coronavirus, it may have reassorted with another coronavirus, one that causes the common cold. And that's why we're seeing the change. And if that's the case, that may be why it has sort of lost the punch. The other theory is that this segment also, a little bit frighteningly, has many similarities to HIV. If that's the case, if it came from somebody who was simultaneously infected with HIV, and we got a part of the HIV virus that doesn't cause immune problems, we may have gotten lucky, right? But also, if it took out part of the SARS-CoV-2 viral genome that was causing symptoms, that may be why it has sort of lost their punch. The other thing to keep in mind is that right now, when the patients who are seeing that are being infected with Omicron, whether it be in South Africa or here in the United States in Houston, the average age is still pretty young. So in South Africa, it's in the 20s. Here in the United States, it's been in in Houston, it's been in the 30s. Those people got infected with Delta, they didn't tend to get terribly sick. So maybe that we're just not seeing it in the elder population, the immunocompromised yet. We'll have to wait and see. So, it's my job to worry and be Dr. Downer and sort of like, worst case scenario. So my worst case scenario here is that it looks like it has lost its punch, not because it's lost its punch, but rather because it's currently predominantly affecting people who have really robust immune systems and are being able to handle it just as well as they were able to handle Delta. So we have to wait and see.
I'm wondering whether or not vaccination rates has a role in that.
Yeah, and vaccination rates. Now in South Africa, the vaccination rate is considerably lower than here in the United States, but also there's a lot of talk that they had a lot more natural illness spreading throughout the country, and so there may be some degree of immunity from a higher amount of natural illness before Omicron came along. Again, the epidemiologists are trying to get the answers to those questions.
Okay. Moderna claims it expects its Omicron-specific booster to rely on boosters for each variant when they continue to mutate. Scott, you want that, or you want David to take it?
No, I'm certainly able to answer that one. So, Dr. Purse a few minutes ago kind of mentioned some comments about, some boosters and stuff, especially those being more specific made to Omicron. And, the variant specific boosters, just like anything else, right? They take time to design. You have to test them for safety, for, effective work, and then have to be manufactured. So Moderna said that, it has a Omicron specific program still in the early stages, but more than likely boosters will not be available till sometime in the spring. We're thinking March, maybe April.
Hopefully Omicron will be gone by then, but we'll see.
Yeah, let's hope so.
All right. Now we have a couple questions related to children. I've heard there's a lower viral load for younger children under 14. Is that true, since pediatric COVID hospitalizations are up at Texas Children's?
So I don't know, but the hospitalizations at Texas Children's are up. In fact, I just looked this morning. I got some data from SETRAC across the region. Since the 18th, which is just 5 days ago, the total number of children hospitalized for COVID has doubled in 5 days. Now, it's still a relatively low number compared to our peak back in August, but it has doubled in 4 days. So, I don't know if there's a lower viral load required to make kids sick or not. I also don't know. I would suspect that kids, only because kids tend to do this with every other virus, they tend to make more virus and spread it more easily between themselves. But what I'm going to be paying attention to really is the hospitalization number.
I think you anticipated the next question. The UK is seeing a record number of under 5-year-olds testing positive. What is showing for that demographic here? And you mentioned that hospitalizations for young children has actually doubled, even though it's relatively low. What is the prevalence of child-to-child spread in the under 5-year-olds ineligible for vaccines? It's so difficult to deal with spread of any germs in that age group. What precautions should we take with kids playing outside other than to keep them outside? Scott?
So, anytime you're looking at, disease, illness spread among little kids, you're going to have difficulty. So, I mean, I have 3 kids that are under 5, and you see children walk around, right, and everything goes in their mouth. They don't even when you do tell them to wash their hands, unless you wash them for them, right? They're still not doing it properly, and they don't understand, right? I mean, they're kids being kids. So that's more than likely just the actual cause, right? Children they're not going to know how to properly turn their head and cough when they, if they're feeling sick, or sneeze, or cover their mouths and stuff. And so it's really going to be more along the lines of the parents and the adults around them to help prevent, the spread from the children. But then that comes into another play, because a lot of times it's maybe these kids and the habits that they have that are then leading to the adults around them to get sick as well. So, I mean, really your precautions, with kids playing together, is try to get them to not put their hands in their mouths, put other things in their mouth, not share things with their friends, right? Like my kids will walk around with one lollipop and pass it to all three of them. We're like, no, you can't do that. You have to just take these, just your basic common sense public health disease prevention practices.
Thank you. Pfizer's vaccine for 2 to 4-year-old appears to be delayed, as they may have to add a third dose regimen. Sounds like this will extend the time to have a vaccine ready. Why can't they just start with 1 dose to get started and eliminate a long wait?
Yeah, it's an interesting question. And so and Scott, I invite your insights to this, but the process that you have to go through to get a vaccine authorized is really complex, and they've got to balance a number of things. They got to make sure that it's effective, so they get the efficacy. And in this group, in this trial, the 6-month to 2-year-old group worked well, but the 2 to 4-year-old group didn't work so well in terms of preventing illness. And so there's a concern that it may be a dose problem, hence the talk about a third dose. The other conversation is that, well, they need to take the first 2 doses and increase the amount of vaccine in the dose. And so those are the sorts of things they're talking about. And so, the FDA has very structured rules. And so, why can't they just start with the 1 dose to get started? Is an interesting question. And somebody at the FDA could probably give you a really good answer, but I'm not. Scott, do you have any insight into that?
Well, I mean, again, it goes back to what you're saying about the FDA having very structured rules, for testing and for their studies. And, you mentioned here that, 6 months to 4, you're getting one set of results, but yet 2 to 4, we're getting a different. And that's why over the years, the FDA has broken it down and become very strict, when they're looking at these different age groups, to study them very thoroughly, especially when it comes into the younger children, just because of the development and the progression of their immune system that tend to change. And there's a lot of other impacts that can come in there and throw it off. So, that's why FDA is so strict on this. They really need to see an effective response before it can be authorized. And I think, I think somebody at the FDA could probably give a better answer than we can on here. But, I think that, what it comes down to is just safety. If they're not 100% sure if this is going to provide the proper immune response, but maybe it's providing something else or could cause some harm, it's better to wait and do more studies than release it.
Not surprised Harris County moved threat level to orange. What is the guidance for the holidays? Please refresh about that level.
So last week, just a couple days ago, we went to threat level orange, which means that there is an uncontrollable spread, the virus, coronavirus in Harris County. So, the CDC is still recommending the self-testing before you do holiday gatherings, where households are going to be joining together, or people from out of the household. And I think the important thing to remember is on there is that, household transmission is 3 to 4 times more prevalent than it is just in your normal open area public setting. So, your best precaution is if you don't feel well, then don't show up. I know nobody wants to be, sitting at home alone, during the holidays, but do you really want to be the reason that 10 or 12 of your family members end up coming down with something as well?
Here's a related but really good question. Have been obeying the rules for almost 2 years and ended up with COVID the first time. I was mask-free in a group. Have had 3 shots and very high antibodies. Any chance wearing a mask has lowered my resistance?
Yeah.
I'm sorry. Go ahead, Dr. Purse.
Yeah, I was just say, so not to COVID. Now, there is an interesting theory when it comes to flu, not so much wearing the mask, but we get a new flu vaccine every year because the flu virus itself mutates a little bit as it circumnavigates the globe from northern hemisphere to southern hemisphere. So your vaccine from the year before didn't go away. It's just the new virus that's coming up from the southern hemisphere has mutated enough that you need a new match for your vaccine. Now, we didn't have much of a flu season last year, or really the year before. And so as the flu sort of like permeates through the community and people get sick with it, they of course develop some immunity. So as a society, we develop increasing, between those who get vaccinated and those who get sick, there's some degree of herd immunity every year that we start with. Now, there's been so little flu activity in the community, and many of us, like myself, have continued to get their flu shot, but we only about 40% of the population gets a flu shot. So there is I am a little anxious about once we get back into another regular flu season that people's resistance to the flu may have been lowered because we've been wearing a mask and not catching the flu. But in terms of COVID, no.
And I think that's a good point too. And one of the other things I think that people have a hard time understanding with COVID that can be very related to the flu is you just talked about it. There's different mutations, different strains of flu that are coming out all the time. And so people are saying, well, how come there's all these different variants of COVID, but we don't ever hear about it with the flu? It's like, well, we don't really go into the detail with it about the flu, all the different variants that develop over time as we do with COVID. And so, I think some people, they try to relate everything with COVID to flu because they're similar, but they don't understand that there's many, many different strains and mutations of flu that come out all the time as well.
Okay, we have a couple of more minutes and I'm going to be fast with these last 4 or 5 questions. First, you mentioned the average age of those being infected is in their 30s. Why? Less vaccinated?
Perhaps. The other thing is we have noticed, and this is where this virus is breaking all the rules, we have noticed, if you think back, that when it first started, we saw a lot in the elderly folks, and then it sort of moved down to the 50-year-olds, and then it moved to the 40. So this virus, it seems to pick an age group to start with and then moves in directions. I've never seen that before. Can't really explain it. So maybe it's because they're less vaccinated. Maybe it's because the virus just is breaking the rules.
Is Delta still spreading at a consistent rate?
So Delta is likely still spreading from infected people, but what we're seeing right now is that the Omicron variant is basically outcompeting it and spreading faster than Delta did.
Okay, there's a reference to COVID parties compared to measles parties. Yeah. The insanity hasn't stopped. Can you think of any reason why our parents should purposely subject their kid to this when we know immunity is not guaranteed? Asking because of a neighbor who is interested. Oh my God.
Yeah. So let me jump on it. Absolutely not. This is a very bad idea. And the reason is that while it's still rare, there are some kids who are having really tragic outcomes with the illness. And you're really asking for, you're playing Russian roulette. Most kids do fine, but the ones who do badly not terribly bad, but they do badly. And that's completely avoidable. Don't do that. Just wait. Just be smart. Wait. Eventually we'll get a vaccine. Eventually we'll hit herd immunity, and that's how the neighborhood, the community will protect your child. I would not subject my child to a COVID party. Absolutely not. Not for an instant. No.
Is it true that people with breakthrough infections are less likely to spread the virus than unvaccinated because they shed the virus for shorter periods of time?
I don't know that that's true.
Okay, with no scientific basis for this statement, it appears each mutation spreads transmission. If accurate, why might this be?
I was gonna say that the general public usually doesn't hear about many of the variants because the majority, they don't increase transmission or result in more severe infections. It's a hard thing to answer.
CDC announced their preference for mRNA vaccines rather than J&J. What is the message to those of us who receive that vaccine?
The thing with the recommendation from the FDA was because there was plenty of mRNA vaccine in the United States, and J&J had that rare problem with the blood clots. So for those folks who got it, if you haven't had a blood clot by now, I wouldn't worry about it.
I want to thank y'all for joining us with COVID-19 Talk with local health authorities, and wish you a very Merry Christmas and Happy New Year. Joining us was Dr. David Purse, representing the City of Houston, Scott Johnson, representing Harris County. Special thanks to past President Kathy Finninger, Rotary Club of Houston, and our producer, Morgan Ash. I'm Stephen Williams, Director of the Houston Health Department. Merry Christmas.